Well, welcome back. So S-163, we just heard from, Boz on. And I just didn't know if there's any committee discussion anyone wanted to have, any questions? Any concerns?
That was the one thing we were waiting for, to find out about the supervision, correct?
That was it. Just wanted to make sure everybody felt like they were in a good place where they felt like they could make a well-informed decision based upon the testimony we received.
I took from it was it's hospital by hospital,
Yeah.
and that was what mattered.
Okay. Well, what version are we?
1.1, although I've made a 1.2 without highlighting.
Oh, Jen, do you want to come on up? I'm sorry. I forgot the whole Jen Kirby, Deputy Chief Counsel, Office of Legislative Counsel. Let's see, that was the new version and just sort of refresh our memories on.
Sure, do you want to mark for the clean?
Let's look at the clean. We looked at the markup last week. If you recall, pretty much everywhere it said APRN, Jen added a equal PA.
Wait. So Jen Kirby, Office of Legislative Counsel, and I will put that. It's just clean version. So this would, in section 1, this adds any physician assistant. So these are the definitions for the Bill of Rights for hospital patients. In section 2, which is the Bill of Rights, it now has physician assistant and APRN throughout, in addition to physician. And then the same thing in section 3, which is the license requirements for hospital licensure. And again, that all patients admitted to the hospital would be under the care of physician licensed under either license type, physician assistant, or an APRN. And that is who would be required to compile professional case records for all patients. The act takes effect on passage, and the title would change to be an act relating to advanced practice providers in hospital care.
Any questions for Jen? Thanks. Well, with that, I would entertain a motion that we adopt S-163 version 1.2.
So moved.
Okay. Clerk, call the roll.
Brian Sheehan,
Yes.
Wendy Critchlow,
Yes.
Alan Demar,
Yes.
Leslie Goldman,
Yes.
Lori Houghton.
Yes.
Karen Leaders,
Yes.
Deborah Powers, yes. Valerie Taylor. Izzy Rebecca,
Yes.
Kara Block.
Yes. That's the second time I've done that. Yes.
So 10-0-0. Oh, yeah.
Oh, yeah, that's right. Oh, yeah. It would be 10-0-0.
Oh.
I love Thank you, everyone. I had a little moment of sadness as you were calling, and I'm like, oh, Tucker really actually liked this bill a lot. It's too bad we didn't.
Favorable with amendment, correct?
Right?
This is-
Favorable with amendments.
Yes. And the reporter of this bill is going to be Leslie. All right, so this will go on notice tomorrow, up for action on Thursday. Maybe we'll have a bill on the floor on Thursday. Sorry, I'm making fun of our action calendar lately. We'll give everybody something to do on Thursday. All right, thank you, everyone. So we are moving on to another new bill. Again, I apologize. We're trying to get witnesses at various times, but it means that we're sort of jumping all over the place. So we got Jen walking us through S-142.
Yes, we have S 142 as passed by the Senate. With the language.
There's not 9 in it.
Okay. S 142 is an act relating to a pathway to licensure for internationally trained physicians and medical graduates. It starts out by, with the section 1, adding a provision to this is in the chapter on the Board of Medical Practice and qualifications for medical licensure, and this would add a new provision on internationally trained physicians and medical graduates, allowing the board to issue a license to such an individual if they have successfully completed the pathway to licensure that is set forth in new subchapter B, 3B. So then section 2 adds to this chapter, subchapter 3B, pathway to licensure for internationally trained physicians and medical graduates. Starts out with definitions. So as used in the subchapter, healthcare facility has the same meaning as in the healthcare administration chapter in Title 18. We tie a lot of definitions to. An internationally trained physician and medical graduate mean an individual who has received a degree of Doctor of Medicine and who has been licensed or otherwise authorized to practice medicine in a country other than the United States. And a participating healthcare facility, which you will see coming up in the bill, it means a hospital, federally certified health center, or community health center approved by the board. This is the Board of Medical Practice, that has the capacity to provide an assessment and evaluation program designed to evaluate an internationally trained physician, as set forth in what you'll see in section 1427 of this chapter. So section 1426 is a provisional license to practice with supervision. This allows the Board of Medical Practice, so throughout this, the board is the Board of Medical Practice, to issue a provisional licensure to practice with supervision to an individual who submits evidence that acceptable to the board, demonstrating that they meet all of the following criteria. First, they have received a degree of Doctor of Medicine or equivalent from a legally chartered medical school outside the United States that is recognized by the World Health Organization or the Foundation for Advancement of International Medical Education and Research, or that appears on the official list of medical schools recognized by the Medical Board of California. And this is the Medical Board of California, I believe, has a fairly comprehensive list. It seems to be what a lot of states use as kind of the official list of medical schools. And so that was the first criteria. They must have been licensed or otherwise authorized to practice medicine in a country other than the United States and have practiced medicine for at least 3 years, unless the board approves an alternative period. They must have provided sufficient evidence to the board that they have done all of the following: demonstrated capacity to practice medicine as determined by the board, completed a 3-year postgraduate program in the applicant's country of training, and practiced as a medical professional performing the duties of a physician outside the United States for at least 3 of the last 5 years. The applicant must not have been out of practice of medicine for more than 5 years unless the board approves an alternative time period. The applicant must have a valid certificate issued by the Education Commission for Foreign Medical Graduates or another credential evaluation service approved by the board, except it gives the board the ability to waive the certification requirement if an applicant is unable to obtain the required documentation from a non-cooperative country. The applicant must have achieved a passing score on both step 1 and 2 of the U.S. medical licensing examination. Prior to submitting an application to the board, the applicant must have entered into an agreement for employment with a participating healthcare facility that offers an assessment and evaluation program designed to develop, assess, and evaluate a provisionally licensed physician's clinical and non-clinical skills and familiarity with standards appropriate for medical practice in Vermont, according to criteria that the board approves by rule, and the applicant must not meet any of the disqualifying criteria set forth in subsection D. A provisional license issued by the board under this section is valid for 2 years, after which the provisionally licensed physician will be eligible to apply for a limited license to practice medicine, which you'll see in section 1428 of the chapter. A provisional license issued by the board authorizes the provisionally licensed physician to practice medicine only at the participating healthcare facility that they've entered into an employment agreement with, and only with supervision, which is set out more fully in section 1427. And then there's language allowing a provisionally licensed physician to change employers during their 2-year provisional licensure period with approval of the board, as long as they have completed a total of 2 years of supervised practice with the participating facility before becoming eligible for a limited license. And then it gives the board some discretion to extend the required period of provisional licensure for up to an additional year if there's been a change in the provisionally licensed physician's site of employment. So then earlier we looked at that list of criteria and it said the applicant must not have engaged in any of the activities in subsection D. Here's subsection D. An applicant is ineligible to receive a provisional license if the applicant has previously had a license or other authorization to practice medicine suspended, revoked, limited, or otherwise restricted based on unprofessional conduct, or they've been convicted of a crime, or they otherwise have demonstrated a lack of competence or lack of moral character.
I didn't measure that.
Yeah.
Who gets to say?
To the board.
The board.
We keep talking about measurements, don't we?
Moral character, yikes.
Well, would the conviction or suspension, revocation, conditioned license, would that extend to if the other country did that?
I believe so, based on the language here.
But if the other country did it, would they get this far?
Country did it, would who get?
If the other country, if there was a problem with you're talking about moral character?
Well, no, not anymore, just any reason. I'm just thinking
I
of,
want to just keep doing I think it would be helpful
Keep
to
doing it.
understand what the whole process is here. And then, yes, there may be certainly changes you wish to make. You also have the reporter from the Senate here, so I want to be respectful of his time. Okay, so participating healthcare facilities. In order to be eligible to be a participating healthcare facility, for purposes of this chapter, a healthcare facility must agree to provide medical mentoring, evaluation, assessment, and support in navigating the U.S. healthcare system by one or more fully licensed physicians employed by that facility to a provisionally licensed physician using an evaluation and assessment system developed under protocols approved by the board. The healthcare facility must ensure that the mentoring, evaluation, assessment, and support of the provisionally licensed physician is provided by one or more fully licensed physicians who are physically located in Vermont, and the provisionally licensed physician only provides services to patients physically located in Vermont. The facility must carry medical malpractice insurance covering the provisionally licensed physician for the duration of that physician's employment by that facility, and they must not retaliate against or discipline a provisionally licensed physician for making a complaint or pursuing enforcement of an employment-related claim. Then we get to the limited license to practice medicine. So that was 2 years of provisional licensure at a participating healthcare facility where they're getting supervised and mentored and evaluated. Within 90 days prior to completion of the 2-year period of provisional licensure, an individual is eligible to apply for a 2-year limited license to practice medicine in Vermont. A limited license shall be renewed not more than once. And after 2 years of practice under a limited license, a physician shall be eligible to apply for a full, unrestricted license to practice medicine in this state. So this is kind of the pathway: 2 years of provisional licensure, 2 years of limited licensure, and then potentially full licensure. It allows the board to issue a limited license to practice medicine to an applicant who meets all of these criteria. The applicant is on track to successfully complete a participating healthcare facilities assessment and evaluation program. The applicant has an offer of full-time employment from a healthcare facility or an offer of continued full-time employment from the participating facility that they have been working with for their assessment and evaluation program. And the facility is located in Vermont and accepts patients covered by Medicaid or Medicare or both. And the applicant has achieved a passing score on step 3 of the U.S. medical licensing examination. directs the board to issue a limited license to practice medicine under this section to begin immediately upon the completion of the provisionally licensed physicians assessment and evaluation program at the participating facility and the end of the provisional license in order to avoid gaps in licensure. Basically, one should follow immediately upon the expiration of the other. And it allows the board to rescind or refuse a limited license to practice medicine if the applicant fails to successfully complete the participating healthcare facilities assessment and evaluation program. And there are provisions around refusal of application for either the provisional or limited license. If the board refuses to issue a provisional or limited license to an internationally trained physician or medical graduate, the board must provide specific reasons for the refusal to the applicant. And a refusal is considered a final order of the board that may be appealed in accordance with the appeal procedures for the Board of Medical Practice. Directs the Board of Medical Practice to collect data. So in consultation with partner organizations as needed, the board would collect information necessary to evaluate the implementation and success of the pathway to licensure established in the subchapter, including the number and types of inquiries from potential applicants, number of applicants for provisional licensure, the applicant's country of origin, licensing country and country of training, the number of provisional licenses granted, the number of provisional licenses refused, the number of limited licenses issued, the reasons for refusals of applications, the number of full and unrestricted license granted to applicants who completed the pathway to licensure, so who made it through the whole process, the number of complaints received regarding holders of a provisional or limited license issued under the subchapter, and the disciplinary actions taken, if any, the practice setting and specialty of applicants in their licensing country or country of origin, and as employed during their provisional and limited licensure, and the practice setting and specialty of the internationally trained physicians who completed the pathway to licensure upon receiving a full and unrestricted license. And annually on or before April 1st, the board would report the information collected under this section for the previous calendar year to this committee, the Government Operations Committee, and the Senate counterparts. Section 3 directs the Board of Medical Practice through the Department of Health to adopt rules necessary to implement the pathway to licensure, including determining which country's licensure or other authorization to practice medicine will be acceptable to the board for purposes of provisional and limited licensure, and establishing the criteria for participating healthcare facilities to use to assess and evaluate a physician's familiarity with standards appropriate for medical practice in Vermont. Section 4 directs the Department of Health by January 15th of 2027. So let me stop before I get into this section. Let me say this section that we just went through, the whole pathway to licensure, would take effect for 2028. Is that a call? Yes, July 1st, 2028. Section 4 directs, in the interim, directs the Department of Health by next January 15, 2027, in collaboration with the Board of Medical Practice, to provide to this committee and the other committees of jurisdiction a report detailing a pathway to licensure for internationally trained physicians and medical graduates as an alternative to the pathway established in Section 2 of this Act. That report would include the following information: a summary of other state processes for licensing internationally trained physicians and medical graduates, and, if available, data on the outcome of these processes and related programs, a description of the external resources needed to evaluate the education, experience, and examinations of internationally trained physicians and medical graduates and the availability of these resources, a proposal for licensing internationally trained physicians and medical graduates to practice medicine in Vermont, including potential qualifications and supervision requirements, a summary of any additional resources and statutory authority needed, and a plan and timeline for implementation, and then any additional information the department deems relevant to a robust consideration of the issues related to licensing internationally trained physicians and medical graduates to practice medicine in Vermont. In preparing this report, the department is directed to consult with other states that have implemented licensing programs for internationally trained physicians and medical graduates, the Vermont chapter of the NAACP, third-party credentialing services, the Vermont Medical Society, Vermont Association of Hospitals and Health Systems, and other advocacy organizations, researchers, and other entities whose expertise is relevant to developing the report. As I said, the sections on the pathway to licensure would take effect July 1st, 2028. the rulemaking provision would take effect July 1st, 2027. And section 4, the alternative pathway to licensure, and the effective date section would take effect on passage. So to explain, the bill as introduced was sections that was the pathway to licensure and effective dates. There were some concerns raised by the Board of Medical Practice who wanted to look at alternatives. There was significant support for proceeding with some kind of pathway to licensure in the Senate committee that the reporter can tell you more about. But as sort of a compromise, the Senate committee pushed out the effective date in order to give the board an opportunity to come back with an alternative proposal that could be considered before the other pathway went into effect. So if there was, if the legislature was convinced that there should be a different approach taken, then you could change course before rulemaking or any other efforts were implemented.
So basically, you're saying section 4 would allow the Board of Medical Practice to come back to us and it would negate 1 through 3.
I mean, you would have to take legislative action.
Yeah.
Yes, but yes, they could come back and say
And say,
this instead.
yeah, this is way too onerous. Well,
Or
they would
have
say,
different
yeah,
approach.
whatever. Okay. I'm sorry, this is the first time I'm looking at this bill. What's currently in statute around license? I mean, I know.
Yep. So as I understand it, what is currently in statute requires, I believe, 3 years of postgraduate training in the United States for an internationally trained physician or medical graduate. Do you know if that's
Basically residency.
what?
But they do the residency here.
Residency has to be here. Isn't this making it a whole lot more than just doing a 3-year residency?
Well, this is allowing them to practice with supervision, as opposed to going through a training program. You'll hear from stakeholders about why they're putting this bill forward.
Okay. Okay, great.
Maybe
Any questions for Jen on the language at all? Senator Benson. Hi, welcome to House Healthcare.
Always hard to follow ledge council with any. But
First of all, we're the House and we're really informal, so we usually use first names. So I'm Lisa, you can call me Alyssa. Nice to see you and tell us about your bill.
well, I was the presenter. I was not actually the sponsor of the bill. Wendy Harrison, or Senator Harrison, was the sponsor of the bill. But in the testimony that we took and on the bill, what we learned is there isn't a simple pathway. This is not actually simple, but a pathway for internationally trained physicians to actually become licensed in Vermont. And so we wanted to look at a pathway that they actually could become licensed. We have a shortage of physicians, particularly in the primary care area. So trying to look at a way that we can actually attract physicians to Vermont was one of the impetus of the bill. The other thing we heard is that there are trained physicians from other countries that are involved in healthcare in Vermont, but they are performing duties well below their capabilities. And so we're not making use of the resources that we have here in the state. The biggest piece that we added to the bill in health and welfare in the Senate was the section 4. And that was the Board of Medical Practice, as you heard, raised some concerns about, geez, we have a small staff taking this on. How do we really do this? Where is it being done? We heard it's being done in New York State. And so what we wanted to do was to give an opportunity for them to spend a little bit of time, but not too much time to look at the process, refine the process, and come back to our committees with any refinements in the process that they felt would make this work smoother or better. What do they need for additional staff? We're not sure at this point. They're not sure at this point. So it gives them basically a year to look at that and come back to us with a plan.
You mentioned New York.
Yes.
What other states have some sort of licensure, path to licensure?
You know, that's also part of trying to have them look at that, where other states. New York just came to us in some of the testimony that we heard. And so we knew that New York had a process. In fact, one of the questions that came up is, you know, do we even look at using New York to do the vetting of these individuals if they have a process set up and so forth? And maybe that's what the Board of Medical Practice may come back with, is say, why don't we either adopt that system or maybe actually contract it out with another state, as opposed to us developing a whole robust process here. So that was really the impetus of putting that section 4 in there. But at the same time, leaving a process in place that actually could move forward and for them to work around.
I'm just curious, and you may not know the answer to this, but I'm thinking kind of two things. If a provider is licensed in another state with a provisional or because another state has a path to licensure, and they become licensed in that state, if they then try to be licensed in Vermont, does all this go away, or do they have to start all over?
It's an interesting question. We did not have that question come up in our committee, but I would think that the Board of Medical Practice would look at that and determine whether they have some form of reciprocity with that other state to basically allow them to practice here in this state.
And is there anything in the bill around the ability to have a compact license? We do have a physician compact licensure. Would they be able to receive a compact license, which would allow them to practice in any other compact?
The bill does not address compact licensure.
Any questions?
Yes,
Mr. John?
simple question. What was the vote in the Senate?
5-0-0.
May I ask on the floor? Because I'm assuming it was a voice
With a
vote.
voice vote.
Was it heavy on the eyes?
Yes.
Or?
There were no questions that came on the floor, and it passed strongly.
Okay, go ahead, please.
Can you remind us approximately how many people this might add to our practices?
You know, we heard some testimony about that. And again, trying to go off memory here, that, you know, this could be 2 or 3, maybe a year at the most. I think, as I recall, New York State was seeing a half a dozen or so. So it's not going to be a huge influx of but you still have to have, obviously, a process to deal with it.
The timelines and the years and all of the things that are in sections 1 through 3, I realize that they probably came as the bill is introduced. Do you know where these came from? Were these recommendations by anyone in particular, or were they just the bill sponsor?
Well, I think the bill sponsor had worked with, and as I understand it, this bill has been around for a while. And so, you know, I believe that Senator Harrison and the other individual signed on to the bill had conversations with, other folk involved in the medical practice field, but I can't cite you exactly who, and how they came up with a specific process.
Go ahead, Daisy.
I worked on this spillover with Wendy.
There you go.
Where'd it come from,
So,
Daisy?
um,
Where the, just like the time
The
period?
Windsor NAACP and then the World Education Commission, I want to say.
But just,
Wyndham, thank you. But Wyndham NAACP led a lot of this.
Okay. All right. Well, thank you.
Right,
Thanks so much for
thank you.
coming up.
Thank you.
Thank you,
So we're just gonna take a break until, our next witness, Senator Lyons, is coming in. She's gonna have all of health and welfare come through here today. Senator Lyons is gonna come up and, talk to us about 197, since that was her bill. We're flip-flopping again. And I did wanna, just to give we're taking some testimony on the bill we just heard on S-142 tomorrow, but we're gonna come back to it on Friday. The only reason is that when this one witness can get in here. So again, I apologize that we're flip-flopping all over the place this week. But let's take a break and we'll be back hopefully within